Okay, it's great to have you all here today. Happy Wednesday. Can you all hear me?
Yes.
Okay, perfect. Thank you, Dr. Chin. All right. Well, we have, let me hide this. I know that this has been a distraction in a couple of other videos. Give me one moment. Perfect. Okay. Okay, so we'll get started here on our osteoporosis discussion. Dr. Robert Chin is our guest speaker. He joined us early in June, I believe, and he did a deep dive into chronic disease. It was wonderful to have him. He's also going to be talking about osteoarthritis today, so that's kind of a bonus. We'll be excited to get into that. As always, we'll begin with our meeting disclaimer. So this recording, our Zoom session is being recorded, and I always upload it onto YouTube in case, oh, have someone new joining. Okay, in case you need to refresh your memory or want to share it with a loved one. I know that Zoom is not always user-friendly, so for those who aren't able to access Zoom and are watching on YouTube, hello and welcome. Wellness Wednesdays are a fall prevention program under our Aging in Place Dignity at Home fall prevention program. And Healthy Aging Association is able to provide these programs to our community at no cost. So our mission is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity and sound health and nutrition practices. We offer exercise instruction. So we have a few great exercise classes. Our most popular is our Young at Heart Strength Training class. I'm sure many of you are immersed in that. We also offer line dancing, Tai Chi, and then soon I will be teaching the Tai Chi Chuan, Moving for Better Balance. And that class will be happening in November. Very excited. And then we do nutrition education and, of course, our fall prevention education. Today, Dr. Robert Chin has a great presentation for you. I'll allow him to introduce himself shortly, but I wanted to get you familiar with two really important bone cells here. So we have our osteoblasts, and how I remembered this when I was in my undergraduate program is osteoblasts. B is for builder cells. So they're very important for bone health because they gather the calcium that's floating around in your blood, and that helps to build new bone tissue. And that's very important for our structural integrity of our bones. And then second, we have osteoclasts. Now, C for the clast, I like to think of it as clearance or like a demolition crew. So if you think construction, the osteoblasts, oh, the sound from the host is muffled. Okay, thank you, Lourdes. Let's see if I can fix this. One moment, please. Hopefully that fixed it a bit. But if you still can't hear me, please throw that in chat and we'll definitely try to address that. So back to osteoclasts. Now, like I was mentioning, the osteoblasts, we want to think of it as our construction builders. So they are really responsible for building that house, right? And then the osteoclasts are kind of like the demolition crew, and they come in and they clear your bone, they clear everything from damaged bone tissue to debris. And so that helps keep the functioning really up to par and allows us to move freely without pain, without inflammation, and eventually will prevent that osteoporosis because of the imbalance that we'll have between these two cells specifically. And Dr. Robert Chin will certainly get into that. So without further ado, I'd like to introduce or reintroduce, for those who were here in June, our guest speaker for this month, Dr. Chin. You have the floor.
Great. Thank you. And welcome, everyone. I'm glad to be with you this afternoon. And I hope that we can talk a little bit about two diseases that are very prevalent in our society and especially among seniors. In fact, it is said that osteoarthritis probably affects just about everybody over the age of 65 to a greater or lesser extent. And osteoporosis affects 10 million Americans, mostly women, but 1 in 5 are men. So men are affected by it too. So let's start with osteoporosis. Let's talk a little bit about it. I'm going to give you some basic facts on osteoporosis and osteoarthritis, but not delve into a lot of depth. Let's give you a chance to ask any questions that you may have, especially as it pertains to pertinent practical matters like what do I do about my aching knee, that kind of stuff. All right. So, some general overviews of osteoporosis. What osteoporosis is a weakened bone. As you know, bone is primarily composed of calcium and a few other materials. But calcium over time diminishes in the bones. And as the calcium lessens in our bones, they are more susceptible to fracture or breaking. Sometimes we don't even realize we have osteoporosis until we've experienced our first broken bone. In fact, I was at a meeting 3 weeks ago when one of the men in the meeting got called out because his wife called him and said that she was walking with a friend and all of a sudden her friend collapsed on the sidewalk. She didn't trip, she didn't slip, her femur just broke and they had to take her into the hospital. So sometimes your first presentation of osteoporosis can even be a broken bone. Now, bone, as Morgan just showed in the slide before, is constantly building and breaking down. They break down old bone that is no longer as healthy and no longer as strong. And then the osteoblast picks up calcium from the blood and makes new bone. So broken bones break. Osteoporosis occurs when the breakdown process is faster than the buildup process, when the osteoclasts are doing their work faster than the osteoblasts. By the way, treatment for osteoporosis consists of altering either one of those. There's medications that slow down the breakdown of bone, and there are medications that speed up the buildup of bones. And we can talk about the treatments later on. What about risk factors? So I told you that 10 million Americans have osteoporosis. Another 40 million have osteopenia or weakened bones. So particularly among postmenopausal women and older adults, 50 million are at risk for breaking their bones, either because they have osteoporosis or because they have weakened bones, what's called osteopenia. It is important to detect it early. Why? Because, for example, when menopause occurs and you lose the help of estrogen to preserve the bones, your bones starts breaking down at a loss of about 20%. So within 5 years, you can have 20% less bones in 5 years. So treatment early on, especially after the start of menopause, becomes important. Okay, next slide. Now, let's look at some of the causes and the risk factors for osteoporosis. When the osteoblast cannot keep up with the osteoclast, there will be a loss of bone over time. We've talked about also how estrogens helps bones to stay strong. So at the time of menopause, or if you have a surgical procedure where the ovaries are removed even before menopause, say in your 30s or your 40s, that can precipitate osteoporosis as well too. Then there are other issues that can cause it. There are certain autoimmune diseases that make osteoporosis more rapid, endocrine abnormalities that reduce the absorption or the level of calcium in the bloodstream can lead to osteoporosis, gastrointestinal problems where calcium might not be well absorbed affects it, and certain medications can accelerate bone loss. What's the number one medication that accelerates bone loss? What's called PPIs, proton pump inhibitors. Those are medications that are used sometimes to treat an acidic stomach, very commonly used. They're available over the counter. They can accelerate some bone loss. And then lifestyle are risk factors. Smoking particularly increases osteoporosis, and alcohol abuse, although alcohol is an interesting one. If you drink only slightly, there's some evidence that it may actually build up bones, but by the time you're taking 2 or 3 drinks a day, you're losing bone. And then, of course, if you just for whatever reason are not taking in enough calcium or vitamin D, that can lead to osteoporosis. And in this day where we all put on sunblock, we're told to avoid the sun, we stay indoors, there are many people that are low in vitamin D and do not realize it. So make sure you at least get that level checked out. Okay, so there are certain non-modifiable risk factors as well. And that means that these are things that you can help. You can help getting older, and age is the number one factor causing osteoporosis. Sex is the other factor, and we've talked about women having osteoporosis 4 times as often as men, usually because they've lost estrogen after menopause. Race is a factor. So certain races have thicker bones. For example, the African American race, and they actually will have less osteoporosis than Asians and Americans. Family history is an important factor. If it's in your family, make sure you get that checked out. But the lifestyle risk factors we've talked about already, particularly smoking and lack of exercise, I would say are the 2 biggest contributors. When you are exercising, especially weight-bearing exercises, that causes the bones to stay strong. And then medications. So, and medical diseases. So diseases like celiac disease or autoimmune diseases like rheumatoid arthritis causes osteoporosis either because calcium is not absorbed well or because they have to take long-term medications like corticosteroids, which increases susceptibility to osteoporosis. Okay, so I told you that you may not even know when you have osteoporosis, but sometimes you might. So what are some of the symptoms that can lead to a diagnosis of osteoporosis? So in the early stages, it's considered a silent disease because there may be no symptoms. But if you do have symptoms, it could be some back pain. So for example, if you have a compression fracture of a vertebrae in your back, you might notice some pain. If you lose height, and it's said that if you have lost more than 1.5 inches of height from your peak height, that can be an indication for getting a DEXA scan to check for osteoporosis. A stoop posture, especially caused by vertebral fractures that makes the anterior part of the vertebrae crush it down, will make you bent over, um, and then bones that break easily. Now, vertebral fractures can cause spinal deformities like kyphosis. That is the stoop back, and may also thereby compress your lungs and cause you to feel short of breath. So if you notice being stooped, you're harder to breathe, that actually can be a symptom of osteoporosis. So early monitoring of these physical changes and getting early detection, particularly via the DEXA scan, is important. And I think the next slide shows this. The DEXA scan is a X-ray study that um, looks at your bones, and it is totally painless. There is no injection of anything into your bloodstream. What it does is it takes X-rays of your bone and at the same time of your soft tissues, and by comparing the two and measuring how much radiation is able to be absorbed beyond the bones and the flesh, they can tell if your bone is of a certain density. And that density is measured by what's called a T-score. A T-score of 0 is your T-score at your bone density at the expected level when you're at your healthiest. So let's say when you're about 20 years old, you probably have about your strongest bone at that point. By the way, bone loss starts occurring probably about the age of 30. You start losing bone then. So let's say at 20, you have your best bone. At that point, it would be expected that you would have a T-score of 0. After that, your T-score starts dropping. So it goes from 0 to minus zero point 0.5, then it's minus 1. By the time it gets to minus 2.5, it is at that level that we call osteoporosis. So screening with the DEXA scan is recommended for people over the age of 50 with a family history. It's recommended for all women by the age of 65 and all men by the age of 70. So early diagnosis, remember we said was important because you can begin to take medications and measures to prevent bone loss right from the very start. All right, let's talk a few minutes about treatment. Treatment and prevention. So medications, the first ones that came out were the bisphosphonates and the hormone therapies like estrogen. And most of those helps to reduce loss of bone. Uh, the newer agents tend to are used for more severe osteoporosis, and they are the injectable ones that sometimes you only have to take once a month or once every 6 months. There are even some that are once a year. The biphosphonates now also have some that are only once a month, and they are oral. Uh, Mostly are oral. You can also take supplements like calcium and vitamin D. And to do that, I would consult your physician to have those levels checked before you take them. You can overdose with calcium. There are problems with taking too much calcium, such as the formation of kidney stones. There can be problems with taking too much vitamin D also, although there's usually a very big range of normal for vitamin D. And then, of course, physical therapy like weight-bearing exercises, walking, yoga, tai chi. Those not only improve bone density, but they improve muscle strength and balance, all of which is very important for reducing falls. So your doctor can help customize a treatment plan for you regarding this treatment. I think that's all I have on osteoporosis. And maybe before we move on to osteoarthritis, I can open it up for anybody that may have a question they want to bring up about your particular situation, maybe, or somebody that you know.
Nicole asked on chat, how often is a DEXA scan recommended once osteopenia has been diagnosed?
Okay. It depends on several factors. It depends, first of all, on how bad the osteopenia is. If you're just on the verge of osteoporosis, I would get it within a year. But let's say your osteopenia, and osteopenia is from -1 to -2.5. Let's say your osteopenia is closer to -1. You can wait 2, even 3 years, unless you have risk factors, like you're taking steroids, or like you have an autoimmune disease, or particularly like you've already had one fracture. If that's the case, then I would get another test in a year.
I have a question. How would patients advocate for that testing, Dr. Robert? I am unfamiliar. Maybe you know.
Okay. So national guidelines says that if you have risk factors, it is recommended to be tested at age 50. Therefore, let's say you're on steroids, or let's say you have an autoimmune disease, or let's say you've had a fracture at an early age at 50. That is reason enough to go to the doctor and say, I believe that national guidelines recommends that I get a DEXA scan at this time.
Right.
So,
Okay.
so
We have Karen in chat, Dr. Robert. She said, I've been diagnosed with osteoporosis. How frequently should I be tested?
So if you are taking medications because you're on osteoporosis, you should get your you should get a DEXA scan about every 2 years, unless you have severe osteoporosis. Then I would get it every year. But
This
because it
is,
takes time for
oh,
these medications to work, usually you don't want to just get it sooner than every year. Usually every 2 years is even enough.
I have another great question here. Um, it asks, what are the risks with hormone therapies?
Yes, so there are risks with hormone therapy as well. Hormone therapy can increase risk for things like blood clots. Therefore, it can be a risk factor sometimes for heart disease. And you have to weigh that risk against your risk for developing osteoporosis. So I see there was a question on what constitutes severe osteoporosis. So if you have a T-score of greater than -3.5, I would call that severe osteoporosis.
Great questions, everyone.
Yeah.
I don't know if
Okay.
you, okay, good.
Yeah, I'm seeing these questions. Difference between medication to build bones versus medications to stop the deterioration of bones. So the medications to preserve bone, namely to stop the osteoclast from breaking down bones, are actually the first line treatment. Those are the biphosphonates, and those are like the Fosamax type medication. Um, and those medications have been around a longer period of time. They are generally speaking less side effect than the medications that help to build new bone. Another one that's commonly used, these are called anti-resorptive medications. There's one called that some of you may be familiar with called Protea. Protea is actually a medication that is is from the parathyroid gland, and it helps to build up the calcium levels in your blood as well. So Protea would be considered an anti-resorptive medications. Hormonal treatments like estrogens and raloxifene, those are considered anti-resorptive and slow the breakdown. The anabolic ones, the one that build up bones, have these strange names to it that end in MAP, or The ones that you might be familiar with that are brand name medicines, the most common one is called Forteo. That's a medication that's given sub-Q about every 6 months. That is also from the parathyroid hormone analog. Another new one is called Evenity, which is a monthly injectable one. And those are ones to build up. The trouble with them is that they're very expensive. And sometimes insurances won't cover for them until you have tried the anti-resortive medications and they fail. You're still getting worsening of your T-score. Then they might permit you to take these other medications, which can cost thousands of dollars a month.
Then we have Michelle, who is asking what current injectable medicines are the most effective for treatment of severe osteoporosis? What are some of those side effects?
Okay. Uh, the anti-resorptive treatment, like the Fosamax type, they do come in injectables and oral. Uh, their major side effect has to do with GI side effects, so upset stomach, nausea, so forth. And then there is one uh, paradoxical side effect of these biphosphonates. They can actually paradoxically cause a sudden fracture of a bone, particularly the femur bone. So here you're thinking you're building up your bones, your DEXA scan even shows better numbers, and all of a sudden your femur fractures after taking it for a couple of years. That's usually more than a couple of years, usually more than 5 years. And that's why doctors generally will restrict these medications. They'll say, let's have you take it for 3 or 4 years. If your DEXA scan is looking good, let's give you a break from it. And then we'll go back to it again in another year if your DEXA scan declines again. It's because of that weird side effect of actually causing a fracture. I know a lot of the specialists really like the one that is called Protea. Protea is a sub-Q one, again, every 6 months, and it probably has the least side effects. It's a little bit more expensive than the other ones, but that happens to be a favorite of many of the endocrinologists. I know some of the newer ones are also very good. They can have side effects that has to do with harming the liver and the heart. So you do have to have your heart monitored and liver enzymes checked while you're on some of these medicines that build up bones, these anabolic medications. And yes, the cost of it, if not cover, I don't know exactly, but my impression is that it's well over $1,000 a month.
Wow. Is there any alternative brand, an off brand that might be another option, or does that not exist?
No, right now there's no
Wow.
brands that are being used. Eventually, of course, these medications will go down after they pass a certain period of time, um, when the patent it wears off. But but right now, those are the only ones available that build up blood. How often should you monitor your heart and liver? Again, that depends on whether you have other things that may be harming your liver, or if you already have heart disease, your doctor can help you decide that. I would say at a minimum, you should get liver enzyme tests done every year, and you should have your doctor listen to your heart, maybe do an EKG every year as well, at a minimum. At worst, if you do tend to have some heart symptoms or heart disease, you may even do a stress test on your heart every year.
Great questions, everyone. I love to see you all interacting.
Yeah.
Um, this is great.
Would
Does
you like to
anyone have,
move on to
yeah,
osteoarthritis?
yeah, everyone, if you end up coming up with more questions, please type them in chat and we'll get to them. Absolutely. So, all right, Dr. Chin, moving on. Oops.
And I'll try to leave time for questions for osteoarthritis at the end also. And if you want to ask another question of osteoporosis, by all means, do so at
Yeah.
the
Oops.
too.
Sorry, I'm going crazy with the controls here.
Mm,
Okay, we left off on that slide. We have covered prevention.
mhm.
No, we haven't. Oh, just the tripping hazards.
Oh, yes.
Yeah,
Yes. Tripping hazards like loose carpets around the house and using assistive devices like canes, walkers. Those are very helpful to prevent falls and fractures for sure.
yeah. It's the most common we see here at Healthy Aging is tripping
Yeah.
hazards.
Okay. All right. So let's talk a little bit about osteoarthritis. Now, um, when I think it's about 65, I started noticing my little finger getting crooked right here. And that's when I knew, oh, okay, I have osteoarthritis too. But osteoarthritis is the degeneration of a joint. It could be as small as your little finger joint, or it could be a big major joint like your hip joint. And most people will experience osteoarthritis in their hips, their backs, and their knees, but it could be any joint at all. It is the most
Doctor,
common form of arthritis. Yes.
sorry, I had a question come into my email. Uh, the individual wants to ask about supplements for the above, and I'm guessing she's talking about um, the vitamin D,
Okay.
possibly the supplements here, the calcium, vitamin D.
Okay.
Um, yeah, if you don't mind addressing that.
Yeah, let's talk about supplements a little bit. So, supplements for osteoporosis is primarily to get those calcium levels and those vitamin D levels to a normal range. Now, again, there's dangers in taking too much supplements, so you have to be careful. There's even been some evidence that people that have overtaken calcium have increased their risk for heart disease. So it's not benign. Vitamin D is much safer. You can go very high in vitamin D, but even vitamin D has been shown to cause some arrhythmia problems in the heart when it's too high. What's too high? Usually a level above 100, I think it's milligrams per deciliter, is too high. Normal is considered 30 to 100 for vitamin D. So check those levels. But while you're talking about supplement, another very popular supplement is collagen supplement. So taking collagen has been purported to help not only with osteoporosis, but also with osteoarthritis and also with muscles and also with skin. They say, the proponents of collagen say that collagen is present in all of those things, your bones, your skin, your muscles. So taking collagen should naturally help those areas of your body. The final verdict on that is not clear, is how I would put it. Most experts in this area would say that the evidence that collagen helps in any of those things are weak at best. Now, collagen is probably very safe to take. All it is, it's mostly amino acids, is what collagen is. It's amino acids that make up the collagen. And it's probably very safe to take, but does it work? And and um, and there is just no good evidence that it works. There's a small study that showed that collagen might have helped with some muscle strengthening, but it was only one small study. Most show that it doesn't seem to do much, and most specialists in this area, while they do not recommend collagen, they do not discourage any patients who say, I'm taking it, I want to try it. Doctors will generally say, go ahead. If it works for you, that'll be great. Okay, I'm going to have one other. Yes, there is collagen that is plant-based. That is correct. But again, the same thing applies. Whether it's effective or not against osteoporosis, it's scant evidence that is effective. It may help a little bit. And I would never tell somebody if you feel like it's helping you, you're being deceived. It's just a placebo. I would say if it's helping you, then take it. But I would not recommend it because the studies just haven't shown a real result that is worthwhile to ask people to spend money for that.
It's a very
One other
expensive
supplement,
supplement.
one other supplement you may think about. What about magnets and copper? Those are used for especially osteoarthritis, but also sometimes for osteoporosis. I would put it in the same category as collagen. If it helps you, okay. It doesn't seem to hurt, other than it might hurt your pocketbook a little bit to spend that money on it. But it doesn't seem to hurt. Some people do claim benefit from it. No studies show any dramatic benefit from it. Okay. I saw another question about exercise and bike riding, uh, any exercise that causes you to bear weight is good for your bones, especially those weight-bearing bones like your femur and your back. Those bones will get stronger. And you are absolutely right. Not only is it good to build your bone density that way, but it builds the muscles around those bones. So you are stronger. You're less likely to fall when you're stronger. You're able to catch yourself when you trip over the sidewalk or something. But if you do fall, your bones will be stronger and they're not as likely to break. Exercise is so important in so many things in life. I've always told my patient you should exercise until the day you die. Okay, back to osteoarthritis.
Yeah, I think we'll answer everyone else's questions at the end because I have some incoming to my email and the chat, so keep typing them in there, and we'll address them at the end of the osteoarthritis presentation,
Okay,
definitely.
maybe I can go fairly quickly through these because I love the questions and
I
I
do
want to be
too.
sure to answer your question. So this is osteoarthritis. Let's go to the next slide. And this is a picture of how it can look like. It can just cause these little bumps in the joints because your bones are trying to help you from the arthritis, from the joint pain. It's building up new calcium to try to replace the calcium that is inflamed and hurting. So it's trying to build new bone, but in the process of doing so, it causes deformities and actually contributes to the pain. Okay, here's how the X-ray looks like. So the osteophyte that you see on that right side is that calcium that's being laid down, new calcium. The X-ray on the left is a completely normal knee. You can see a little space between the two bones, the femur and the tibia. That space is filled in by collagen and that acts as a cushion to the bones. But when that cushion wears out over time because you walk a lot, or you're overweight, or you have some sort of deformity that wears down the collagen, then pretty soon it's bone touching bone. And that causes, instead of a nice, smooth, lubricant type surface where the bone can slide over each other, now the bone is on a rough surface and it rubs against each other and causes pain with every single step you take. The risk factors, again, number one is aging. It's like, by the time you get to 60 and 70 years old, your your joints just wear out. The soft tissues just wear down and become very thin. Or you get joint injuries from playing football and other things that you've done over the years. Obesity definitely puts a stress on those weight-bearing joints, particularly the knees, the hips, and the back. And then genetics is a risk factor. You'll see people with a genetic history of osteoarthritis develop osteoarthritis early on in life. But anything that causes of repetitive stress on joints um, is causes osteoarthritis. Okay, next. The symptoms then, mainly joint pain and stiffness. So the joint pain in osteoarthritis, as with the stiffness, occurs early in the morning when you first wake up. That's because you haven't used those joints at all. They've been able to rest. And now when you suddenly put weight on them, it hurts a lot. Uh, it can actually start to get a little bit better as you use your knee and you walk around. But by the end of the day, after you put a lot of weight on your joint, it starts hurting again. So very commonly, joint pain and stiffness occurs after some resting. The swelling is because of the inflammation process causes fluid to just ooze out of the joint. These are fluids that are trying to heal the irritation there, but it turns out that sometimes this fluid itself worsens the inflammation. Reduced range of motion means you just can't move your knee or your hip or your back as much. It's because as these osteophytes form, they also make you have a limited range of motion. And when you do move those joints, when you do force it to move, you can sometimes feel the bone rubbing against the bone, and that's what causes that grating sensation that you can feel. By the way, does cracking your knuckles worsen osteoarthritis? The answer is no. No evidence that cracking knuckles really does worsen it. It may, the only harm it does is it might irritate the person sitting next to you, and that's about it.
I learned in undergrad, correct me if I'm wrong, but when you pop your knuckles, that popping sound that you hear is actually a chemical reaction. It's not the bone.
Yeah, yeah, it could be that, or sometimes it could
Yeah,
be the tendon snapping as well, too.
yeah.
Right. Okay, how's it diagnosed? Most oftentimes with an X-ray. Sometimes, in order to see it better, particularly to see if something else is going on. For example, if you have joint pain in your knee, is it osteoarthritis or is it a meniscus tear? Because just about everybody at age 65 and above has some osteoarthritis in their knees. If you go in the doctor's office and you say, my knee is suddenly just hurting me a lot ever since I had a little fall, he may not be able to be certain whether it's the arthritis that got worsened or whether you tore a meniscus. And that's when things like an MRI can be helpful and needed. Same thing with the back. The back tells if the if the space between the vertebrae have been crushed down or if it's because the joints themselves are wearing out. Okay, next slide. Here's the treatments. So number one is always lifestyle modification. You just have to change the way you do things, and you automatically do that. So instead of jogging, you might do more walking now, or you might go on an elliptical ride, or you might take the bike. But you get to the point where you can't even do the elliptical ride or the bike, and you might end up doing more exercises that are very low impact, sitting on using a chair to help you do exercises or exercises like yoga. So you just automatically alter your lifestyle so that you're not constantly causing pain in that joint. Weight management is important. For every 5 to 10 pounds that you lose, you can notice an incremental reduction in the pain of a weight-bearing joint. Uh, so you can tell changes already just losing a few pounds. And then physical therapy is actually very helpful. Physical therapy helps to strengthen the muscles around the joint so that you're not putting as much stress on the joint. The muscles pick up some of that stress. It also trains you to know how to line the joint or walk in a way that you're not putting an unusual strain on a back, let's say, or on a certain hip. Medications is would be a second line treatment because there, as you know, are always potential problems with medications. The ones that have been most prescribed for osteoarthritis is Tylenol or acetaminophen, is the safest of the of the medications, safer than what's called anti-inflammatories. Those are the NSAIDs. Those are the non-steroidal anti-inflammatory medications like ibuprofen and Aleve and Advil. Those medications, while probably a little bit more helpful for pain, is more harmful to the liver and the kidneys, particularly the kidneys. So if you're on prolonged NSAIDs, I recommend that you make sure that you get your kidneys checked on a at least every 6 months basis. Now, topical pain relievers actually I think are a very good choice because they're very safe. They're like Voltaren, those kind of medications. They're analgesics that you can apply to the joint itself, and you can put it on as much as every 4 hours. They're not as strong as the oral medications like the acetaminophen. You have to take it more often, like every 4 hours, but they don't have side effects unless you get a skin irritation from it. So they're very safe to use. What about injections? They are helpful, but they tend to be temporary help. So there's hyaluronic acid that's injected most commonly in the knees. There are corticosteroids that can be injected in any joint. They will stop the inflammation process. It's inflammation that causes swelling and pain, and you will feel good maybe for a couple of weeks, but then the pain can start gradually coming back. A lot of people, for example, will take a corticosteroid injection if they're going on a trip and they say, I'm going on this cruise for 2 weeks and I want to be able to enjoy myself. Can you give me a steroid to help me through the trip? Or they may have surgery coming up, but they say, while I'm waiting for my surgery, can I have the corticosteroids to take away the pain? Many times your doctor will recommend that you have hyaluronic acid injections before recommending surgery, not because hyaluronic has been proven to be that effective, but because many times insurance companies say you have to go through that step before they would approve surgery. So unfortunately, it's one of those steps that has to be taken in by some insurances in order to get to step 4, which is the surgery. Joint replacement surgery and arthroscopic surgery. Arthroscopic surgery is losing some of its appeal now, mainly because it hasn't been long-term as helpful as we originally had hoped it to be. Joint replacement therapy, however, is still a definite option and still seems to be very good. Some joints are better than the others at getting replaced, by the way. So, for example, hip replacement is a very good joint surgery, better than knee replacement. There seems to be a higher success rate with that. So, but these joint replacement only last for a certain number of years, usually less than 20 years. So if you're 50 years old, they may not want to do joint replacement surgery on you because at age 70, you may have to have a second one. But if you're, say, 60, they might say, let's do it. You probably will only need one in your lifetime. This will last you the rest of your life. Okay, next slide. All right, so living with osteoarthritis, the assistive devices, again, like the canes, like a walker, like a wheelchair, those can be very helpful, particularly at preventing fall and preventing pain. Staying as active as you can, even if it's a little bit of pain. I still like to encourage people to stay active because activity does seem to slow down the process of joint inflammation and wear and tear if you're using your joint. If you just don't use your joint, they deteriorate much quicker. Joint protection strategies are things like using a brace. So, I love to play pickleball, and I've been getting a little bit of knee pain. So lately, I've been wearing a knee brace, and when I do and play pickleball, I don't get that joint pain at all. So protective devices can be very helpful. Next. Now, let's talk a little bit about prevention, and this partly depends upon your age. In your 20s and 30s, when your bones are still good, when you probably don't have any arthritis, that's when you want to build a strong foundation. That's when regular exercise helps to prevent osteoarthritis. So you've heard me say that osteoarthritis can come from years of wearing down a joint. But if you exercise where you're not putting an excessive amount of stress on that joint, but you're putting a little bit amount of stress on that joint, that actually in strengthens and improves the joint and makes it more flexible. It makes the muscles around it stronger. So you're less likely to get osteoarthritis later on in life if you're exercising moderately. Somebody asked the question, how much is moderate exercise that's needed? The recommendation is to do 150 minutes of exercise in a week. So let's say you're exercising 5 days a week. We're talking about exercising for about 30 minutes, 5 days a week. That would make the 150 for the whole week. That would be a good amount of exercise for bone strengthening. The nutrition is important. So by nutrition, I mean don't eat a lot of the inflammatory type foods. What are inflammatory type foods? Processed foods are inflammatory. So try to, not eat these prepared processed foods. Eat more natural foods as much as you can. Eat a lot of vegetables and fruit. Vegetables have a good source of calcium to help build up your bone. Um, Fruit is very good anti-inflammatory and antioxidative for that's good for your whole body, but also for your bones and your joints. Avoid excessive high impact sports injuries. So, when you're in high school, you think that there's nothing more important than winning that football game. Well, I think preserving your joints and not getting injured is more important than winning that football game. Exercise some common sense and don't get yourself injured uh, if you can help it. Okay, enjoy your sport, but take care as well too. And then starting your 40s and 50s, you have to start monitoring. You have to start monitoring for joint pain. You have to start making sure that you're not gaining the weight that puts a stress on your joint. You have to start checking to see if you're eating the right kinds of foods and doing regular exercises. So avoid repetitive joint, let me say excessive strain. Get regular checkups for joint health. Starting at age 60, prevent progression. If you have joint pain, go check it out, get an x-ray, see if you're getting some arthritis developing, and then change your lifestyle, change your exercise habits, prioritize low impact activities that would minimize further injuring your joint. Using good shoes and good ergonomics, like a good ergonomic chair protects your back. Good cushion shoes protects your knee and ankle joints. I am a runner, and my general thumb rule is to change my running shoes every 500 miles of running. 500 miles, you can get there in about 6 months. So your shoes at 6 months still looks really good, but you've lost that cushion. You got to get either a new cushion or new shoes at that point, and then seek early treatment for stiffness or pain. Okay, next.
Okay. Thank you, Dr. Chen, and we will address these questions. I'm only going to briefly touch on muscle loss because it really is interrelated here with osteoporosis and osteoarthritis, and that's called sarcopenia. It's basically a decrease in the number and the size, or you might have heard the term hypertrophy of your type 2 muscle fibers. We have subcategories in the type 2 muscle fibers. We won't get there, but we do have the type 2B, which is most common. So if you are noticing a decrease in muscle function, strength, you may want to consult with your physician and talk about sarcopenia. Now, Dr. Chin has already really gone into detail about our ages and how we function with strength throughout those timelines. So we have our peak strength in the 20 and 30s, and just to reiterate, that's the time to really build a strong foundation. But at this point, we're getting into our 30s and 40s. We start to see that plateau or that gradual decline of muscle function, if we don't stay on top of it, right? This is not for everybody. Some people are really on top of their exercise and their weight bearing trainings. But if we haven't done that, then it is common to see a plateau or gradual decline in that muscle. And then it really starts to accelerate if we maintain these lifestyle habits into our 60s and so on. So common symptoms are obviously, the leg weakness, but you might also notice that some older adults have the kyphosis. And Dr. Chin mentioned earlier the stooping, right? It's not a very nice term, but the back is more hunched over, and that could be from sarcopenia, but also other conditions out there. So weight bearing resistance training is the most important. There are so many activities you could do for your weight bearing resistance training. And this includes Tai Chi. You can do the Young at Heart exercise class that we have here. We work with resistance bands. We can do Tai Chi Quan. We can do yoga. There are so many great ways to bear that weight and kind of fight back against gravity in that way, because gravity plays a big role in how we decline as far as muscle goes and bones too. So it's a good way to kind of fight back against gravity. And the benefits of the weight bearing resistance training is cognitive. So we improve the communication between our brain synapses and our muscles. It aids in protein synthesis. It improves your body composition, which we've really highlighted. Dr. Chin has really highlighted today. Body composition really does make a difference in pain. And then, of course, it reduces your risk of falls and fractures, and the hip fractures are the most jarring as far as mortality rates and incidence rate as well, because your hip and correct me if I'm wrong here, Dr. Chin, but if you do break your hip, it's not like you stay in the hospital until it heals. You'll likely be moved to a skilled nursing facility or a rehabilitation clinic until that heals, and you're working with your PTs and OTs, which really increases the cost. So you'll have to bear that financial burden. And it could, result in mortality or complete loss of function. So, and then staying in a skilled nursing facility or a rehabilitation hospital really does make you feel that loss of independence there. And that's what we're trying to maintain here. So, do your due diligence of removing those rugs and those cords and those tripping hazards. It'll be very important. And then I did a little flow chart for you here, just to interconnect everything and really bring it to light. So we're going to interconnect sarcopenia, osteoporosis, and osteoarthritis, and how they affect your life, because it's so much more than you might be thinking, right? There are so many areas in our life that can decline due to these conditions. So, for example, if we have reduced muscle strength, like I just stated, that could impair our activities of daily living, right? We had that discussion back in July about how important activities of daily living are for well-being and for autonomy and independence. And so if your ADLs are impaired, then you're not as self-sufficient anymore. You're having to rely on those caretakers, those families, those friends, and that can lead to poor mental health which then can lead to social isolation. So it's so layered. It really is like a big onion, right? Life, life is like an onion. And then on the other side here, related to the osteoporosis and osteoarthritis, if we're experiencing less bone loading, which means we're not weight bearing as much, that exercise is very important. If we're not as physically active, that can certainly lead to a loss of your bone mass, and then result in osteoporosis. Where does that lead to? That can lead to increased bone fractures, leading to immobility. And that circles back around here to poor mental health, decreased autonomy, impaired ADL, socialized. They're all interconnected, if you can see. But something that I'd also like to highlight here is sleep disturbance, because that really has an impact on your well-being and your cognition and being aware of those fall hazards, right? So we want to make sure that we're taking care of these conditions here and consulting with our physician to increase all of these areas of life. I also haven't even mentioned the financial cost here. I know I did shortly before, but I mean, the financial cost is highly expensive. I think it's $17 billion a year spent on osteoporosis treatment. But I'm talking about personal finances, right? And that certainly adds to well-being and mental health and socialization, because if we can't afford to do anything or put gas in our car, we're likely going to self-isolate, and then it just all starts again. It's an endless loop. So care for yourself here. I'll end there. And then after this slide, I'll let Dr. Chin answer some questions. As many of you know, we will be holding our annual Fall Summit for Fall Prevention month in October. And this is near and dear to my heart. Dr. Chin will be there, so you will get to meet him if you would so like. We have all these screenings, but most importantly, for today's session, we will have bone screenings, so bone density right here. This might be a great opportunity for you to come get checked out, right? October 10th is very quick, and maybe quicker than you're able to get into your primary care physician. And these are free resources. So always consult with your physician. But in the meantime, it might be a nice indication of where you lie on the bone density spectrum. I'm going to turn it back to you, Dr. Chin. Your presentation was great. I just want to thank you. And let's get back to these questions here. Okay.
It's 2 o'clock, so if anybody needs to leave, I'm
Yeah,
not offended if you leave, but I will be here to answer any questions if you have any for me.
great. Okay, let's start. We've answered Nicole. What is the recommended amount of type of exercise? We've answered this. Okay. What are your thoughts, Dr. Chin, on the corticosteroid or hyaluronic acid injections versus surgery?
Okay, so there is nothing that rebuilds collagen once it has been worn out in the joint. Um, and neither steroids nor hyaluronic acid makes that space uh, appear again. It will, on the X-ray, always show bone on bone thereafter. So anatomically, there is no cure other than surgery. Medications like corticosteroids and hyaluronic acid just temporarily helps to reduce the discomfort by stopping the inflammation some. But it can come again, sometimes it may take weeks or may even take a couple of months before you may experience that pain again. So I think that the ultimate solution for severe joint pain, if you just can't live with it, maybe you choose to live with it, which is fine. We all live with aches and pains, right? And if you say it doesn't bother me so much that it stops me for doing most of the things that I want to do, then don't get surgery because surgery is has its risk and surgery can be very costly and surgery can tie you up for several weeks, if not more. And then sometimes surgery doesn't work. You can go through an entire surgery, go through the whole pain and process, and you feel like you're not any better as a result. But if there is a chance to be better, it's going to be with surgery, not likely these other things.
Is hypothyroidism a contributing factor to osteoporosis? Also, can Lyme disease impact osteo conditions?
Um, I have not heard of hypothyroid contributing to osteoporosis. It's the parathyroid gland that regulates the calcium and the phosphorus level. So the parathyroid can affect it. Now, sometimes when a person has like a thyroid disease and they have to have their thyroid gland removed, which makes them hypothyroid. In the process of removing the thyroid gland, the parathyroid glands may be inadvertently removed. And then you do get osteoporosis, but it's not because of the hypothyroidism. It's because when they remove the thyroid, they might have also knocked off the parathyroid, which is right there by the thyroid. That's the only relationship that I see. Hypothyroid by itself does not contribute to osteoporosis. Does Lyme disease impact osteoarthritis or osteoporosis? Lyme disease can cause arthritis, arthritic pain. That's one of the long-term chronic symptoms of Lyme's disease. So yes, it definitely can.
Thank you for the thorough information, Dr. Chin. It's been very helpful, says Nicole. Then I had one more question for you, and then I'll let you get off because I know you have responsibilities as well, Dr. Chin. Besides um, prescription drugs and exercise, what builds bones?
Okay, prescription drugs and exercise. So certain foods. So the foods that uh, will cause bone to deteriorate are those foods that are highly anti-inflammatory. So, for example, a lot of alcohol is harmful. So eating foods that are anti-inflammatories, like berries, for example, those kind, and then a lot of the green vegetables, those can also help to make bones a little stronger. But I would say that number one is exercise to build
Yeah,
your bone. And then number two would be the diet and eating well.
I agree. Okay. Um, well, everybody, I really enjoy. Oh, Lori, I'm thinking of when or if to take or stop a calcium supplement. What's the best one?
Okay.
What's the best way to gauge?
Yeah, the best way to gauge two, I would say two things. One, get a blood test to check the calcium levels. Um, but then number two, check to see if there are any symptoms that you may be taking too much calcium. So if you're taking too much calcium, you may, for example, get kidney stones that are calcium stones. If you are not taking enough calcium, you can get some muscle cramping pain. That would be one of the causes of low calcium, and that might be an indication to you that you don't have enough calcium. Getting a blood test can be helpful. It's not the best help because sometimes what your blood shows is not the same as what the level of calcium that's in your bones and in your organs, but it is helpful. it can give you an idea of whether you might be low or high in calcium as well.
Right. Okay. I answered you directly, Karen, but for those wondering, yes, this will be posted onto YouTube. Typically, it takes me a day or so because I need to do other responsibilities here. Um, and I'll need a little bit of time to edit, but other than that, I'll send out an email tomorrow with the video link. And once again, it's been a pleasure having you on this month. Again, Dr. Chen, thank you. You're great to watch and very insightful. So we really
Great.
appreciate it.
Thank you.
You're
Thank
welcome.
you,
Okay,
everybody.
everybody. I will
Good
see you
night.
next month for our last Wellness Wednesday together. So I hope you tune in and you will take great care. Okay. Have a great day. Thanks for joining.
Bye-bye.
Bye.